Inner Quest explores various pathways through which you can connect with the infinite wisdom of the universe and apply it to personal, professional, and spiritual growth. This program, featuring accomplished practitioners, educators, and authors, is provided by Infinity Foundation, an innovative center for holistic studies and research. We invite you to share this journey with us.
Hello, welcome to Inner Quest. My name is Jay Stone, your host for today, and our guest is Tina M. Zion. Welcome, Tina.
Thank you very much.
I appreciate you making the drive from Fort Wayne, Indiana, to our Highland Park studio. So let me tell our audience a little bit about your background. Tina is a fourth-generation psychic medium and medical intuitive. Tina is a registered nurse, international speaker, Gestalt-trained mental health counselor, and clinical hypnotherapist. Tina is the author of Become a Medical Intuitive, the Complete Developmental Course, and the Reiki Teacher's Manual. She is also a contributing author in Michael Newton's latest book, Memories of the Afterlife. Now, Tina, you're a registered nurse, so can you tell the audience a little bit about your background? Because nurses do different jobs. It can be surgical nurse, intensive care, ER, OBGYN. So tell the audience a little bit about your nursing background and then how you became a medical intuitive.
Okay. I have been a nurse since 1979, and I never worked medical nursing except in my clinicals and training from Purdue. So I've always been in the mental health field, even from the time I graduated.
What does it mean, a nurse in the mental health field, like working at a psychiatric hospital?
Yes, I've worked psychiatric hospitals, mental health centers, different places in the country that I've worked in those areas. Yes, so I also worked as a mental health counselor on the Navajo Reservation in New Mexico.
How was that experience?
That was very different. I have a lot of Native American stories and things that happened, and it was wonderful. I miss it.
So when you went to nursing school, you specifically went to work in the mental health field?
Yes. That was my goal. That entire time was to work in that, because I just love that. I love the depth of people. I love the complicated lives of people. I just really love that. And then really how medical intuition happened is my entire family is very, very intuitive. So I grew up in a family that this was very normal. In fact, we all call it vibes. We vibe each other. We do see people in spirit. So it was a very, very natural thing to me. And the medical intuition began just kind of spontaneously as I was working with people, especially when I was working with people with Reiki. Yes, so that's how that kind of fit in together.
Now, you're a fourth generation intuitive.
Yes.
And but is there a specific reason why you call it fourth generation? So your great grandparents were?
It was my great grandmother, and then my grandmother, and then my mother, and then myself. And also on my father's side, his parents, so my grandparents, also were very active in the spiritualist church. So it was very natural.
You mentioned spiritualist church.
Yes.
Is that a specific denomination?
Yes, it is.
Oh, okay.
Yes, it is.
Okay.
Yes.
Now, does having three generations of intuitives in your family before you enhance your intuition?
A lot of people think because of that I have a special skill, and what I really want to get across to the listeners is it's a learned skill, that it's simply a matter of noticing in a different way, that the only positive thing that this did for me was it made it so natural. And so I grew up in a family that we all talked about it. So to me it was very, very natural to have a foot in the physical world and a foot in the non-physical world. But I have learned that people can learn how to do this.
Okay. And what's the first step to learning to become a medical intuitive?
Oh, well, I teach about becoming intuitive in general, just noticing intuitive information around you. The air is rich with information around us as we sit here right now. It's rich with information. Every thought that's ever been thought in this studio tends to linger. The human thought lingers, and energy follows the human thought. So it's very, very natural. So I kind of step by step teach people how to start accessing that, and then we go into a more medical situation.
Well, if thought lingers, what about those negative thoughts or angry thoughts?
Well, they linger too.
Yeah.
And in fact, the stronger the emotion, the more the energy will linger. But it can be strength with joy and bliss and happiness, because that's a powerful emotion, or can be filled with, guilt and sadness and grieving and things like that.
Now, in your book, you mentioned Dr. Herbert Benson, who's a cardiologist by training and started Harvard's Mind-Body School of Medicine. But he talks about one of the benefits of deep relaxation, or what he calls the relaxation response, is increase in intuition.
Yes. He's very, very open to it. More and more scientists are open to it. Gary Schwartz. I love Gary Schwartz. He's a Harvard-trained scientist as well, and he's working to try to prove, or at least research, that our consciousness continues beyond our passing, beyond death. And so there's more and more scientists that are becoming aware of this.
Okay.
Yes.
Can you define medical intuition for our audience?
It's intuitive. The medical intuitive, when they work with another person, when I work with another person, we enter into that energetic story that is with each and every one of us. As you sit there, you have an eternal story going on. And as I sit here, I do as well. So it's about entering into that story and picking up the important aspects of it. But then the medical intuitive also goes in and really notices, where energy is not flowing as well. They can tell where shoulders, struggling with a lot of responsibility on it. So I teach people about going in more deeper also, literally into the physical body.
Now, in your book, you mentioned how you saw a woman, and you saw something unhealthy in the woman. Mm-hmm. And was that your first experience?
That was my first experience. I was actually at a woman's conference, and she asked me if I would give her some Reiki because she had a terrible headache. So I said sure, and I was working on her, and just spontaneously, and she was my first person, I was actually looking inside of her lungs, and I could see the inflammation. I could see which lung was more inflamed than the other. I could see how the lung was structured.
When you say see, are you seeing with your eyes or your mind's eye?
But I guess I would say probably my mind's eye in that case, because I had my eyes closed and was just working on her, and so in my mind's eye, I could see inside. And I shared that with her, and she said, I'm going to quit smoking pretty soon.
Yeah.
She did.
So she knew smoking was harming her lungs, and
yes.
You were picking up on that. And also in your book, you mentioned like one of the first rules is you never give a medical diagnosis as a medical intuitive.
Correct. And that's really, really important, because medical doctors, physicians can diagnose, but the medical intuitive cannot legally diagnose in our country.
Well, what happens if the medical intuitive saw like a dark spot in the lungs that could potentially be cancer or something?
Yes.
How would you encourage the person to seek further assistance from a medical doctor?
What I tell medical intuitives is we can't diagnose, but we sure can describe. So I would describe the darkness that I saw in the lung. I would describe the size of it, how dense it felt, just all of my perceptions about it. And I would say, please, I want you to go to your medical doctor. I want you to go right away because what I'm perceiving is a stagnant energy, and I want you to get it checked out.
And do your clients often say, I've been having a problem there? Do your clients ever come back to you and say, I went to the doctor and they found something?
Yes. I have a whole list of validation because, sometimes even I wonder, am I accurate and what's going on here and why am I so accurate? And people will come back, they'll email me, they'll validate what I perceived all the time. So it's very validating to have that happen. It's really neat.
Now, you mentioned before the show how the author Michael Newton, who you contributed to his last book, retired. Do you ever think about retiring, or are you just enjoying this work and feel it's your calling that you want to keep on doing it as long as you can?
No, I'm not planning to retire at all. My private practice has fluctuated, and it's fluctuating again because I'm doing less individual readings and more mentoring sessions to help other people build their abilities. So I'm doing a lot of what I call mentoring sessions.
Oh, and what goes
as
on?
well.
What goes on in a mentoring session?
I don't have an agenda. It's when the person contacts me and we have that appointment. For an hour, I really ask them, where do you feel like you're struggling? Where are your ways that you know that you're doing very well? And then I help them really jump over a lot of these hurdles because people really just get in their own way. For us to be intuitive, it's the most natural perception that we have.
Do you think children are more intuitive than adults?
They're very intuitive. In fact, listen to what little kids say. Now, they'll tend to not voice these things, from like 6 and 7 years old. I think they're getting more acclimated to the
Culture,
earth,
society.
and culture and society. But boy, from the time they begin to talk up to that age, 6, 7, they're saying all kinds of very wonderful things. Like my own granddaughter, when she was 3, she kept saying to my daughter, her mother, don't you remember when I was the mommy and you were the baby? Mm-hmm. And she said, no, I used to be the mommy and you were the baby. And so they'll say just really phenomenal things. They'll tell you angels came to them and things like that.
Did your daughter ever respond to that?
Oh, yes, she was very, very fine with it. We're very encouraging, especially to the little ones, because they're coming up, they're the next generation. And I have one granddaughter that is very, very aware of the non-physical world.
And so how does one, besides medical intuition or intuitiveness, how does one also cultivate the intuition? We talked about meditation as a possibility.
I ask people to notice the world around them, that everything has meaning. I sat at an intersection, a busy intersection one day, and I closed my eyes because I was sitting at the red light, and I was struggling in life about something, I don't even remember now, and I put that question out to the universe for some guidance and an answer about something. I opened up my eyes, and a semi-truck went through that intersection with a word all across, I'm getting chills saying this, a word all across the side of the truck, which was exactly the answer. So
are you going to tell us that word?
It was actually a Native American name.
Okay.
And I had asked for confirmation for a guide. And I opened up my eyes, because I thought, I better check to see if the light's green. And I opened it up, and there was written all across the track. It's everywhere in our environment. This isn't a special thing. And so I guess how I'd answer you is I help people to perceive and notice their environment first.
So you think intuition is available at any given moment, at any given place?
Absolutely.
Okay.
Absolutely.
And so how do we know when we're following our intuition?
The more and more I follow my intuitive awareness, the smoother my life gets. People who do not perceive, we're surrounded with help also in the non-physical world. And our guides are right there with us if we allow it, if we invite them in.
When you say guides, I assume you mean spirit guides?
Yes, spirit guides. Yes.
Yeah.
Yep. Spirit guides in the non-physical. And it's simply a matter of allowing yourself to be aware of these things.
Okay. Now, is there a difference between a medical intuitive and other intuitions?
Sure. Even a medical intuitive, when we start with a client during a session, that we will pick up the general story of their life. We will tend to pick up, that they might be struggling with their job, or pick up that, they are worried about a grandchild or something like that. So we'll pick up the general information that another intuitive would normally pick up. But what's different about the medical intuition is that we share that story, the things that are prominent in their energy field, but then we go in more deeply and try to do like a head-to-toe assessment and just describe whatever we notice.
And is that typically the path you start at a person's head and go down to the
Well,
chest?
I have that goal a lot of times, but I worked with someone just 2 days ago, and I was pulled in just immediately down here into her abdomen. So I have an intent to do a head to toe, but I always go with wherever I'm also pulled to, because it will tend to be the area that they're struggling with.
Now, our audience may not be familiar with Edgar Cayce, and so why don't you tell our audience a little bit about Edgar Cayce, and then I'm going to follow that up with a question for you.
Oh, okay. Edgar Cayce was very, very, very famous. He was called the Sleeping Prophet, I think, was his kind of a nickname that people gave him, because he wasn't aware of what information he would get. People would think he was in a coma or asleep, and he would just lie there and share all this information, and very, very medical too, very medical. He had a lot of remedies that he would just channel, and when he was done, he would wake up and would have no idea what he said.
Right, and
No
somebody
idea.
would be sitting, scribing
Yes,
what he was
yeah.
talking about. And I could recall there was cases in which Edgar Cayce dictated remedies to a person and the address and the name before the person even sent the letter to him. And so
Yes.
my question to you is, part of Edgar Cayce's fame is the remedies. Do you ever give remedies like Edgar Cayce?
I do. And we need to be careful with that too, because I'll always follow it up, even though I'm an RN. I will say I'm really getting very strongly, this has happened just recently, I'm getting very strongly that you need vitamin D in your system. I'm getting very strongly that you could use some probiotics. Thinking about that woman I worked with a couple
Sure.
days ago. And so I will get those and I will share that. And I will always say, but follow it up with your doctor. So a lot of that comes through.
Now, do you record your medical intuitive sessions on a DVD or a CD or anything?
I recorded them for years, and just a couple of months ago I stopped recording because I can't really keep up. And I also have so many clients now internationally that I have a lot of people for phone sessions and Skype. So I have clients all over the world now, which makes it almost impossible for me to record them, but I ask for them to record their own now. I just couldn't keep up with it because
I
they're
think
everywhere.
it would be very helpful to the person who's having the session with you
Yes.
to review it, because typically if we go to a doctor or healthcare professional, we might remember a sentence or two, and we'll just cling to that, and there was
Yes.
all this other stuff we've missed.
People will email me back and they'll say, it's a good thing I recorded it because I didn't really hear you say this and I didn't hear you say that. So I really recommend that people record it.
Okay.
Yeah.
What led you to write your book? Write your book here.
Well, I started to kind of wow myself out about the accuracy that I was having. And so I started to study myself. And I studied myself for, I think, 7 or 8 months. And when someone would leave, I would jot down, well, I noticed it this way and this happened. And, and I felt like I went into their body in this way. And so I just started to study myself, and then I thought, I want to teach other people how to do this. My goal is to have a domino effect that other people all over the world will know how to do this, because this is truly integrative medicine. It's not stop going to your doctor, it's this complements what the medical field is also doing. And I actually have more and more physicians, chiropractors, MDs, physical therapists coming, nurses, a lot of nurses coming to my workshops.
And do you think the majority are women? Do you ever?
No, I have quite a few men.
Yeah.
Yeah, quite a few men.
Oh, that's good.
I
Well, I remember speaking at University of Chicago Medical School, and there's people from all these different cultures, and they're bringing in their traditional medicines from their culture of origin and combining it with their medical practices.
Yes, very much so. Other countries are opening up to this all over the place.
I think some other countries are probably ahead of us.
They're ahead of us.
Yeah.
They're ahead of us. Yeah. Yeah. I do a lot of sessions where there's a translator because they're in other countries.
What countries?
Just last week it was China.
Oh, wow.
Yes. And I've taught in Romania. I'm going to New Zealand to teach again.
And then you mentioned before the show your book is in how many different languages?
Oh, it's my publisher told me 18 now.
That's great.
Well, and that's my goal, is to get other people to realize this is not some special gift that I have or other medical intuitives have. This is something that they can learn and perceive to help people out.
Excellent. Now, could anyone learn to become a medical intuitive?
Mm-hmm. Yes, yes, yes. If they decide in their mind that they can do this, they can do it. If they decide they can't do it, they will not be able to do it. So it's,
Well,
it's that thought, the power of thought.
In your book, you said
What?
it takes practice, practice, practice.
I practiced, and a lot of that book is based on my practice also.
Let's see. There was something I wanted to ask you, and I kind of lost that thought. So tell us some of the key points of your medical intuitive workshops.
Key points. The key points would be, I have found that people have set ideas about what intuition should be. And if you have a set idea, then all that really means is you have a set idea that's getting in your way. Because most people feel that if you're going to be intuitive, you have to see everything with your eyes. And that's simply not the case. There are many routes to perceive the information from another person.
Right. You can talk about the mind's eye. You can feel it. You can hear it.
You can hear
maybe even smell or taste it.
You can smell or taste, yes.
Yeah.
Yes.
Now I remember that question I wanted to ask you. Well, now I just lost it again. What about using the medical intuition on yourself? That's what I wanted to know. So as you're learning to read other people, can you turn it around and read yourself?
You can, if you can be truly objective and not be afraid to find something in your own body. So that fear will get in the way. So emotion will get in the way. I am not clear at all for my own family members because I'm too emotional. I don't have that objective, neutral stance that I have
So
with
is there
people.
someone you refer your family members to?
Not so far, no. No,
Okay.
I don't.
Okay. I know there's a question in here. Do you need to meet with your clients in your office for you to pick up intuitive information about them?
Well, that's again one of the other rules that people have, that they aren't intuitive because they think they have to have the person right there in their office, or they think they have to see everything. Those rules always get in the way. So that's one of the biggest hurdles in my workshop, is to jump over those hurdles. But I ask people to be aware of what their
You did mention expectations
hurdles
in your
are.
expectations in your book and how
Yes.
they can hinder us greatly.
Yes.
But the
yes.
fact that if you got clients in China and all those other countries, you know, you don't have to. Now,
It doesn't matter. It's just as instant as if the person was sitting in my office.
And
this
of
close.
course, Edgar Casey, you know, his work.
All over.
Yeah.
All over.
Now, you said you do your work through Skype, so you're actually seeing the person.
But most of them are on the phone. So people, I will call them, wherever they're at, and most of them are on the phone. So I don't even visually have to see them either. I kind of like follow the sound of their voice and their name. So I like repeat their name inside of my mind and just kind of
Like a mantra.
send it out there, yeah.
And then when you're doing the reading, are your eyes closed?
For the most part. Because for me, I'm looking into the back of my eyelids.
And do you ever give some information like Edgar Casey and not remember what you said?
I won't remember in that same day people that I saw that morning. I won't have a clue what I said to them. Now I will for a little while, but I will lose it very, very, very quickly because I'm in a bit of an altered state as well.
Higher consciousness.
Yes, but certainly not into that level that Casey went, where he had no recognition. I know that
It's like
the person.
somnambulist.
Yes. So I'll know that the person was there, and I'll kind of remember some details about it, but then it'll be gone.
Well, we got about a minute to go.
Okay.
What else would you like people to know about you, your work, or becoming a medical intuitive?
Just to know that it is open to them. They do not have to be a special person. They don't have to have a special gift. They just have to have the yearning to want to open up their intuition and to really hone it and perfect it and work with the body, the mind, the spirit, and the emotions.
And of course, there's always your book to help people
Yes.
get
Thank
started.
You, yes.
Yeah.
Yes.
Have you ever met Carolyn Meese, by the way?
Yes, Yes, I have. Yes. She
Good.
put medical intuition on the map, yeah.
Yeah, and she's local to the Chicago area.
Yes.
Well,
I'm aware of
I
that.
think we got to wrap it up now. So more information about Tina Zion, Infinity Foundation, or Quest talk show, stay tuned to the credits at the end or look us up on the internet. Until next time, wish you good health, good fortune, and good spirits. Tina, it's really been a pleasure to meet
Thank you so much. Thank you.